Hello, Mihiraa. I understand you've been experiencing some troubling symptoms. Could you tell me what's been going on?
Yes, thank you, Dr. Daniel. So it's been, about 4 or 5 months now, and I've been having these persistent issues. At first, I thought it was just a regular cold or maybe some allergies. But it hasn't improved. In fact, I feel it's gotten progressively worse. My nose feels constantly blocked, like not just congestion, but completely obstructed at times, and I find it almost impossible to breathe through it. And then there's this intense pressure around my face, mostly across my forehead and around my cheekbones. It's like a heavy, dull ache that just doesn't go away. Sometimes, the pain radiates all the way down to my upper jaw, which makes it really hard to eat or even talk for long periods. I also have this strange sensation in my sinuses, almost like a weight pulling downwards. I've noticed my sense of smell and taste are severely diminished, too, which makes food taste bland. It's all just very frustrating and exhausting.
See. And do you experience these symptoms continuously, or do they come and go?
That's the odd part. It's pretty constant, but sometimes, especially at night, it feels like it intensifies. I've tried lying on my side or propping myself up with pillows, thinking it might help with the congestion, but it only provides minor relief. The blockage seems to worsen when I'm lying down. There's also a lot of mucus, yellowish, thick, and sticky, and occasionally I feel like there's a bit of blood in it, which really worries me. And I forgot to mention, I also have this nagging cough. It's mostly dry, but occasionally I do cough up some phlegm, especially in the mornings.
Thank you, Mihiraa. That's very thorough. Have you tried any treatments or remedies up until now?
Yes, quite a few actually. At first, I tried over-the-counter decongestants like pseudoephedrine. Those didn't do much, honestly. Then I moved on to nasal sprays, saline rinses, you name it. I even tried a corticosteroid spray, which my pharmacist suggested could help with inflammation, but after a few weeks, I didn't notice any improvement. I've also tried steam inhalation with eucalyptus oil to clear my sinuses, and while it does provide some temporary relief, it's short-lived. I even tried some herbal remedies like turmeric and ginger tea, thinking it might reduce inflammation, but again, no luck.
Right. And Mihiraa, how about your medical history? Any history of respiratory issues, allergies, or surgeries in the past?
Well, I've had asthma since I was a teenager, but it's generally well controlled with my inhaler. I've never had any surgeries or major illnesses. I do get seasonal allergies, but they usually resolve by the time spring ends. This feels different, though, more persistent and intense. It's also strange because I feel exhausted all the time. I don't know if it's due to the lack of sleep from not being able to breathe properly at night or if it's part of the condition itself.
Thank you for that. From what you've described, Mihiraa, it sounds like you might have nasal polyps, which are non-cancerous growths in the lining of your nasal passages or sinuses. They can cause symptoms similar to what you've been experiencing, including nasal obstruction, facial pressure, diminished sense of smell, and sometimes a postnasal drip that can lead to coughing.
Nasal polyps? I've never heard of those. So, would that explain the constant blockage and pressure in my sinuses? All right. So, assuming it's nasal polyps, what would the treatment involve?
In most cases, we start with a course of corticosteroids, often a nasal spray or oral corticosteroids, to reduce inflammation and shrink the polyps. For larger polyps, or if these measures aren't effective, we might consider a surgical option known as functional endoscopic sinus surgery, where the polyps are removed to open up your nasal passages. This is generally an outpatient procedure with minimal downtime. Mihiraa, in addition to that, I would recommend continuing the saline rinses since they help clear any mucus buildup. For managing potential infections that often accompany polyps, an antibiotic may also be prescribed, but only if there's evidence of bacterial involvement.
Surgery sounds a bit intimidating, but if it will help me breathe normally again, I'll consider it. Are there any risks associated with it?
As with any procedure, there are risks, but they are typically minimal. Potential risks could include bleeding, infection, or, in rare cases, recurrence of the polyps. I'll walk you through all the details if we determine surgery is necessary. For now, let's proceed with the nasal endoscopy and CT scan to get a clearer picture. I'll arrange a follow-up appointment for next week to go over the results and decide on the best course of action.
Thank you, Dr. Daniel. I really appreciate your help. It's a relief to know there's a possible solution.
You're welcome, Mihiraa. Rest assured, we'll work together to find the best approach for you. I'll see you next week for the results, and we'll take it from there.